Welcome back to Rural Health News, this segment of Rural Health Today, where we fill you in on the latest in rural health headlines. We'll cover 3 headlines in today's episode: what's most urgent, a rural health damage report, and a success story to send us into the week. First, what's most urgent? Over the past few weeks, hospital leaders and U.S. legislators have been lifting their voices to hold the federal government accountable to supporting rural health. A group of senators sent a letter to Dr. Oz, the administrator of the Centers for Medicare and Medicaid, asking for targeted adjustments to the Rural Health Transformation Program. As we encounter more and more rural hospital closures, hospital leaders, community members, and local, state, and federal policy members are speaking up about the insufficiency of RHTP. We hear more heartbreaking stories of patients losing access to cover and to see the evidence of hospital closures throughout this nation. Awareness of HR1's effect is crucial to the future of rural health, especially as we engage in the struggle to ensure RHTP funds actually support rural hospitals rather than putting them at a disadvantage. On to the damage report. A recent study by the Commonwealth Fund shows that because of HR1, or the One Big Beautiful Bill, by 2029, Medicaid and ACA funding reductions will negatively impact state economic activity by $197 billion and eliminate 165 million jobs across this country, and that's just the first 2 years of HR1's implementation. The study projected that 229,000 jobs will disappear before the end of 2026, and every state will experience the effects of economic losses as hospital closures increase. When we remove such a vital economic driver from our community, jobs across multiple sectors disappear and rural neighborhoods lose their long-term sustainability. Hospitals employ nurses, doctors, and technicians, but they also employ dietary and environmental service aides, human resource professionals, medical assistants, security officers, administrative staff, and many more types of professionals offering employee support and career advancement in counties often lacking other opportunities. Without these jobs, our national unemployment rate will go up and our communities will suffer expanding population deserts as economic structures collapse and healthcare disappears from rural America. And now for today's success story. Due to healthcare workforce shortages and training access issues, rural emergency rooms often cannot afford staff nurses trained to conduct sexual assault examinations. This creates more travel time for unnecessary stress of our survivors of sexual assault. St. Luke's Health System in Idaho developed a sexual assault telehealth program that connects assault survivors to nurse examinations across the state, ensuring that location does not impact access to specialized care. So far, the program has strengthened community trust in local hospitals, and hospital staff report feeling more supported when handling sexual assault cases. Solutions like these highlight the importance of specialized healthcare access no matter where someone lives. Thank you to our sources for this episode: Becker's Hospital Review, the Commonwealth Fund, and Healthcare IT News.
Thank you for listening to another episode of Rural Health Today, the podcast where we connect you to what really matters in rural health. Rural Health Today is a production of Hillsdale Hospital in Hillsdale, Michigan, and a member of the Health Podcast Network. Our host is JJ Hodshire, our producer is Kirsten Newlon, and our audio engineer is Kenji Ulmer. Special thanks to the Hillsdale Hospital marketing team. If you want to submit a question for us to answer on the podcast or learn more about Rural Health Today, visit ruralhealthtoday.com.